All right, let's try to talking with my microphone on. Hey, good afternoon, everybody. Welcome. This is Michael Lochtefeld. I am the president and one of the co-founders here of LOCAH. And before we get started here today, I'm just going to ask board members to quickly turn on their camera if they are available and do a quick intro. Just say who you are and what your position is, and then we'll get started. So why don't we kick it off here with Miss Angie Hoff. And Angie, you're gorgeous, but you're muted.
Shoot, sorry guys, I thought I took myself off mute. Hi, I'm Angie Hoff. I'm a family nurse practitioner with At Your Door Visiting Healthcare Services. And I am the lead for the MDs, NPs, and DOs. Oh, and Valerie's here with me.
Hey, Valerie.
Hi, everyone.
All right, and we'll just go down the line. Olivia.
Hi there, my name is Olivia Huffine and I am the SNF lead.
All right. Who's next? Just go ahead and go for it because I can't see who all is with us here today. Not all at once.
Hey, everybody. This is Nick Thompson. I'm the vice president and one of the co-founders of LOCAH.
Hey, Nick.
And I'm Patrick Carl. I'm the assisted living lead.
Hey, Patrick.
Hi.
I'm Ashley Stewart. I am the home health lead. I work for Enliven Home Health and Faith and Family Hospice.
Hey there. All right, and do we have any hospital board members with us here today?
Hello, I'm Melissa Swempa. Sorry, I'm driving, so I can't put my camera on. I'm one of the board members. I'm the treasurer, and I'm with Gentiva Hospice.
Hey, Melissa.
Hi there. I was muted. Sorry. I'm Natalie Moscato. I'm with Collins and Cruz Law Office, and I am a board member as well.
Hey, Natalie. All right, now Jennifer with your gorgeous holiday sweater.
It's holidays here at East today. So I'm Jennifer O'Brien, Regional Director of Case Management, UR and Transfer Center for Mount Carmel Health System.
All right, and I'm not sure if we have anybody else. If not, we'll go ahead and we'll get this kicked off. All right, so just a quick overview for everybody. LOCAH is a volunteer-operated nonprofit 501c3 organization. We are headquartered here in Columbus, Ohio. Our mission, our organization is committed to excellence in care coordination during care transitions, primarily those related to current and recent hospitalization. Our vision is to educate, advocate, and elevate communication for Columbus area professionals to best match the needs of those being served. And we consist of a multidisciplinary board and members comprised of healthcare professionals. We promote collaboration between hospitals and post-acute providers, and we strive to provide tools and solutions that allow professionals to work more effectively, simplifying communication and coordination of care. All right, so I wanted to start this off since we're going to do an overview of 2023. And I went ahead and gave you a little bit prior to that. So our organization got started in October of 2021. And in 2023, we had set out a roadmap for accomplish. We wanted to publish an updated member guide that helps folks as they are trying to communicate and collaborate with area hospitals for current patients that are hospitalized, as well as those that are in need of new service. We also looked to welcome OSU to our board. That was one of our goals. We looked to expand our committees and enhance their functions, enhance our directory profiles with key details from member surveys, increase advisory board engagement with the industry they represent, and membership growth, as well as the advisory and executive board nominations for 2024. So those are the goals that we had identified for the year. So how are we doing? So for our guides, we did publish an updated guide in March of 2023 with the details from each of the area acute care hospitals in Franklin County. to facilitate that better communication and easier communication, especially with events related to care transitions. We welcomed OSU Comprehensive Care Center, Lisa Graham, to our board representing them. And then we also welcomed from OSU Western Medical Center, Heidi Hefflinger, to represent their services. Committees. We implemented systems that automated most of our functions that committees were intended to support. So we had a membership committee, an orientation committee, a technology committee, and essentially we were able to put systems in place that removed the need for those to be person managed. So those goals, 2 of those goals here, we've revised. Advisory board engagement. We launched several roundtable sessions to promote engagement with discussions of care transitions, hospitals, and other related topics. For 2024 board nominations, 6 additional seats were added to the Executive Advisory Board. Nominations and applicants were received for 3 seats available in 2024, and there's opportunities available for some additional new seats. And then membership growth. We accomplished that goal as well. We started the year with 178 members, and here today we are at 226. So what else happened in 2023 that wasn't part of our roadmap? Well, we identified several pressure points related to care transitions with area hospitals. Those include wound care for patients that are discharging home, patients with e-sitters discharging without notification or documentation to facilities, errors and inconsistencies in after-visit summaries, late discharge times causing issues with medication availability for patients going to facilities, and start of care not happening timely for patients with home care or delay in visits after their initial visit. In addition to those pressure points, we launched some resource library enhancements on our website that included a SNF transition considerations chart, a nationwide SNF CMS survey patient list tool, a provider update and announcement tool, an employment update tool, and a nationwide SNF destinations map. Continuing on what happened in 2023, we had some tech woes. We fought with technology. So we had launched our enhanced member and service provider profiles in our directory to support easier coordination of service, to support better communication, to be able to identify service providers based on specific needs, insurance, and et cetera. But with that, we had a universal login approach that was plagued with issues. People continued to be locked out. It wasn't easy to access. So in June, we launched member-specific logins. But with that, it resolved one problem and created another. We weren't able to transition everything that we had loaded into that directory into a universally accessible one for our members. We also launched a member center to try to make things a little bit easier. But again, folks had a really hard time logging in with that, even with their new member specific logins. So to combat those challenges, last month we launched a new web and mobile application to provide easier to use, easier to access information, to coordinate care and to communicate with one another. That is called Care Coordinator. And it's available in a mobile and web application to all of our members here today. And I will, as we get through to the end of the slide, to the end of it, I'll give you a quick demonstration for those of you who have not yet logged in and checked it out. So what's our roadmap for 2024? Well, we wanted to take a new approach to our meetings. So historically, we have had bi-monthly meetings, bi-monthly general assemblies, bi-monthly hospital board meetings, bi-monthly board meetings with our advisory and executive board. It was a lot. And so as we looked to refine our approach to have more effective, more quality engagement, we've decided to transition to a new cascading meeting schedule. So each quarter, is going to begin with a roundtable session. So each of the industries that we have an advisory board member representing, they are hosting an advisory board roundtable. With that, that is the first month of each quarter. The second month of each quarter, we're going to be hosting our board meetings. So we're eliminating the standalone hospital board meeting and incorporating that with our advisory and executive boards. Information that is presented and discussed at the roundtables will then be flowed right into the board meetings for all of us to review, discuss whatever obstacles that you guys are experiencing, whatever frustrations you have, whatever, updates or news or enhancements or innovations that you guys have to share. All that information from your meetings, we will review that at the board meetings to see how we can effectively respond to it. And then at the end of each quarter, it's going to end with a general assembly. For 2024, our schedule so far, our first quarter is going to be hosted by Ohio Health at either Riverside or BAC. We will follow up with that as we work that organizing. The second quarter, it will be hosted by Mount Carmel, and I believe that is at Mount Carmel East. And then the third quarter is going to be hosted by OSU at the Wexner Medical Center. And at the very end of the year in December, we have yet to decide how we want to approach, and we will share more as we solidify that plan. Roundtable sessions. So, my color coding did not translate. That's all right. When I publish the slides, you'll be able to see, and we will publish this schedule to our website as well. So we look to host a case management and social work roundtable. Dates are yet to be announced. Assisted living, behavioral addiction care, DME, MD, DO, and APP, private duty home care and nursing, skilled home health and skilled nursing facilities, as well as transportation. So that's the tentative schedule of roundtables that will happen at the beginning of each quarter, and they happen on separate days. So in the event that you have overlap, say that you offer assisted living services and you also offer skilled nursing services, it'll allow you the opportunity to engage in both of those if you so wish. In 2024, we've also revised our meeting template, how we're going to do our general assemblies. So they're going to start with a hospital presentation. And this is the template that we're providing to hospitals as they decide on their presentation. So the PowerPoint will consist of a case management overview that discusses their model, any innovative or effective approaches that they have applied, their leadership or management contexts, and primary role or responsibilities of those individuals, making it easier for you to know who the right person is for your communication based on what your need is. Post-acute care needs. So an assessment of the current landscape based on that health system or hospital, the challenges that they're seeing as they try to coordinate post-acute services from their case management and social work. And what underserved needs or services are needed and where. Helping us as post-acute providers to step up to the plate and say, all right, so you need this service in this area. Let me see if I can provide that for you and your patients. Post-acute discharge analytics. So we look to have a comprehensive review of discharge trends and data by site, ideally from the last 4 quarters where data is available. Examples would be percent of patients discharging home versus home care versus SNF versus hospice. And if available, to break it out by payer category, Medicare A, Medicare Advantage, Medicaid, and commercial plans. If they have a high performance post-acute network, insight into the performance network and how it's going, goals, outcomes, and then eligibility for those who might be interested in participating. And any other additional highlights that the hospital would like to provide to us as members of LOCAH. Followed by that will be a followed by that will be a presentation by a sponsor and then by our board. And at the end of our meeting, we are now going to post a 30-minute connect session where case management leaders and staff are encouraged to engage directly with our members post-presentation. Pretty much what's been happening, at our meetings as folks look to connect, and we don't want to have to rush you guys out to get things set up for the next meeting or to clean up. So we're going to go ahead and designate that 30-minute period for great direct engagement with case management and social work. Additional goals for 2024. So we'd like to add enhanced profiles for additional service providers and care coordinator. Right now, there are specific levels of care that have enhanced profiles. Launch Care Navigator, a public-facing version of the platform for patients and their next of kin. Add board members for the 3 new seats in transport, DME, and infusion, as well as to find a candidate for grants and philanthropy. We look to grow membership in those new areas of behavioral and addiction care, transport, DME, and infusions, and look to continue to develop our roundtable sessions for effective identification of industry challenges related to care transitions. We're going to be welcoming some new board members. So I'd like to introduce Amy Schwederman. She is going to be taking Patrick's seat in 2024 as our assisted living lead on the advisory. She's currently with the Ohio Assisted Living Association. She's had 18 years of experience in senior care, and more information about Amy will be published here soon in biographies or in bios on our website. Brittany Wallace is going to be joining us as our advisory board behavioral and addiction care lead. She is currently employed by Brightview Healthcare. They're a mental health provider for those in the community. Brian Menegay is going to be joining our executive board as our senior coordinator, and he currently works for Legacy Health Services. And then Natalie Moscato currently is in a legal and financial lead position on our board, and she's going to be transitioning into a secretary position on our executive board, helping us keep things running. And we're going to do a wrap up. So before I do a wrap up here, I'm going to go ahead and dig into care coordinator, and then we'll answer questions. If I can do the window. All right, can you guys still see my screen?
Yes.
All right, so when you navigate to LOCAH.org, there is now an option for you to select care coordinator on the left-hand side. When you do so, it'll open in a new window and you'll be prompted to log in with your LOCAH member ID. Generally, it's your first last name at LOCAH.org. And if you don't know your password, reach out and we'll help you get that reset. When you launch Care Coordinator here, it's going to show you services, and it's also going to show you requests through Ask LOCAH. You can scroll through these and select Browse. It'll tell you here if enhanced profiles are available or if they only offer basic profiles at this time. Here on the right-hand side, if you would like to ask somebody to help you find services for a patient, you can select Add. Fill out a simple request here that talks about what service level, where you're looking, insurance, those key information pieces to find a care provider. And when you submit that request for providers, for members who have updated their profile within Care Coordinator, they will get an email as well as a text message notification for the service level or the for the service level in the area that they provide services. So for example, if I'm a home health agency or a hospice agency and I provide services in Franklin County and somebody submits a request asking to find services for home care or hospice, they will receive a notification via text and email, allowing them to jump in and respond if they are able to provide recommendations on services for that need. And then you can also view them within here as well. So for example, say that, we have Michael here. Michael's looking for recommendations on assisted living waiver providers that are capable of providing or accommodating the behavior of exit seeking. And here it will show you they're looking in Central Ohio. And so say my name's Nick Thompson, and I don't provide assisted living waiver services. I won't receive any notification via phone or email, but I can still read through these requests. And in the event that I know somebody who can meet that need, I can click contact here, and it will pull up information for me to reach out to Michael and say, hey, I can't help you, but I know who can. On the Home tab, it's going to go over current events. You can see here our General Assemblies here. Gives an overview, allows you to register. Anybody can post events here as well. For example, the American Case Manager Association has their conference coming up in February, so this allows you to get information about that. And if you have events or there's other relevant information that you would like to post, you just simply click add and fill out, and it will show up here for folks. If you have an employment update, like you see Brian Menegay here, he is now with Legacy Health Services as a hospital liaison and account manager. You can jump in and read information that he has shared. So he's covering the Delaware, Marion, and Bucyrus areas, as well as assisting with the Columbus market. And then it also shows where he was previously employed. So as we try to follow folks during their employment transitions, that makes it much easier. There is provider news. So you can see that they've posted the Legacy of Bucyrus has shared that they now have a new cognitive spa memory care. So it allows folks to stay in the loop with what's going on. You can see here there's some new services coming to Ohio State at Talbot Hall. Legacy of Dublin's doing TPN. There's a position at the Ohio Rehabilitation Institute, and so on and so forth. I will go ahead and jump into the member section. So say that you know that there's a liaison or a specific contact at a certain company, but you can't remember what their name is, or you remember their first name but not their last name, and you don't have them in your phone. You can jump in here, and if they're a member of our organization, you can search by name, company, position, a plethora of things. So for example, I'll search Majestic Care, and we see here there's 2 members from Majestic Care with our organization. You can click on their profile, and you see here Olivia Huffine. She's a Senior Director of Business Development for Majestic Care. They offer assisted living and skilled nursing services. There's her contact information, the facilities that she covers, and so forth, making it much easier to connect with that liaison or that person that you're trying to have that follow-up communication with. You can also filter, jump in here and search that way as well. Here under your account, it's going to give you information. So you see here's some settings that I've sent. I'm saying that I offer assisted living services that are waiver. Here's the counties that I provide services in. Here's the number that I want to receive text message notifications at. And then public profile information allows you to set that as well. Really easy to click edit, update this information. And what we've done is we've loaded providers across the country into here. So say that I want to go ahead and I want to say, oh, I work for a nursing facility. You click on the field and you start typing it, and it's going to pull up providers, and you can say, all right, I work at Violet Springs. Let's save that. And it will automatically update throughout the system, connecting me with those providers, allowing folks to find me based on who I work for, and helping to stay on top of everybody throughout their employment here. All right, so the next and last thing, and the kind of the meat and potatoes, is the service module. So what we look to do here is make it much easier for people that are looking to locate services. So a lot of these have availability. We'll jump into the acute care dashboard, and you see here it's got Ohio facilities currently loaded. I can jump in here and see Mount Carmel East. There's some information that hospitals will be able to publish, so I've just put some basic information in there at this time. And then it also has their case management staff. So if you have a patient that you know is in the emergency department, jump in here, look for their emergency department social worker, have that communication. You can click on their profile, it'll bring in and give your information, give their information to you based on what they've shared. Back to services, jump into a care setting. So nursing facilities. It's going to sort facilities based on who's most recently updated their pages here. So Sycamore Spring of Miamisburg was the most recent to submit updates. So their profile here is at the top of the page. You can see they've updated here with what their bed availability is, information as an overview. Really important stuff when you're trying to have good communication. Who's the administrator, director of nursing, social services, so on and so forth. So as somebody that's trying to communicate for a care transition, it makes it much easier to know who you need to speak with. And you can also see it has staff here. So when you update your member profile, it's going to go ahead and directly update facilities or providers that you've associated yourself with. So Amy here, she's the Regional Director of Admissions and Marketing with CareSpring, and she covers this site. So it allows me to go ahead and have that direct communication with her. It also goes over primary care and specialists, insurance plans, conditions and symptoms, so on and so forth. And if I want to search for something, I can just simply go in here and search for it. So TPN, it's automatically filtered the facilities here that offer TPN, or I can jump in, filter it based on very specific criteria that folks have filled out. Say we're looking for a bariatric patient, and say that we need somebody who accepts Aetna, and we want Aetna CVS Health. Let's add just one of those, not two insurances. And there you see, here's the providers that can meet that clinical need, that have the specific insurance plan, and then you can reach out to them based on whoever that contact is. Brittany Pollock here is the admissions coordinator. You can reach out to her directly. And you can do that for various service levels. And that's an overview of Care Coordinator. All right, and so questions. That is the end of my presentation here today. That's an overview of what we've done here in 2023 and what we're looking to accomplish in the road ahead for 2024. And yeah, so we'll open it up. Is there any discussion, questions, or things that anybody has? Board members, anything that you would like to share or address yourselves, go ahead and jump in, and go ahead, Olivia.
I would just like to say thank you to everybody who is a part of this organization. I know that several people on the board have put in a lot of hours to make this thing go. And I think a lot of times, I'm not saying this for me, I'm saying more for like Michael and Nick, and they're really like the backbone of this organization. And so I just want to give a special shout out to them. They've poured their hearts into this, and you can see all the changes that have happened over the year. And I think that it's just, I think it's important just to say thank you to really getting this going and solidifying, you know, our new plan and how we're going to move forward. So it's definitely been a lot of work, and I certainly appreciate that. And I know I'm not the only one, but I just wanted to say thank you. So yeah, thanks a lot.
Thank you. Absolutely appreciate that. What we're here to do is to make our jobs easier and make our lives easier. We've got very difficult situations that we navigate every day as we're trying to make sure that patients receive the care that they need. And we're often under-resourced and undermanned and have obstacles. And that's the goal of our organization, to bring everybody together, discuss those, action plan, provide tools, and take action to resolve those and make things better for everybody. So thank you. Anybody else have anything? Any questions? Well, a virtual session is a lot less work than meeting in person. Maybe we should just do this every time.
No. Don't get any ideas.
Let's see, we have something in the chat here.
I already checked it.
Coordinator, and thank the efforts. Oh, thank you, Jamie. All right, well, this was short, quick, easy. If anybody has any follow-up questions or things to dig into, please feel free to reach out. We will, one more point I will address. So I would definitely encourage you to go ahead and access Care Coordinator on our website and update your profile. We will in 2024 be utilizing the information generated from Care Coordinator for all of our email communications. Historically, email's been a challenge for us, especially as people transition and keeping that contact list up to date. And so by updating Care Coordinator, you yourself will be responsible for receiving those communications. So I hope you guys have a happy holidays, and we will see you in 2024.
Thank you, Michael, for all your hard work.
Thanks, Michael.
Thank you.
Thanks,
Bye,
Michael.
everyone.
Thank you. Happy holidays.
Everybody.
Happy holidays.